The opinions expressed are those of the host. The material is for informational purposes only. It does not constitute investment advice, and it is not intended as an endorsement for any specific investment. Visit crestmontpw.com for more details.
You are listening to the Ascent with Crestmont Private Wealth. I'm Alec Walker, EVP of Financial Planning in our Houston office. I am joined today by Carly Rosswurm with Ash Brokerage. Carly runs the Medicare division with Ash Brokerage. We got introduced to her a few years ago, and her team have been a great resource for our clients, answering their questions on Medicare and many times helping them get enrolled in the policy that best suits their needs. Carly, thanks for taking the time to join us today.
Absolutely. Thank you so much for having me.
I thought first, Carly, it may be helpful for you to just maybe explain a little bit about who Ash Brokerage is, who you are in your experience, and what you and your team does at Ash Brokerage in the Medicare division.
Yeah, definitely. So I first got life and health licensed back in 2006. And the cool thing about that timing is that 2006 is when the Part D plans first got mandated. So Part D, if you're on Medicare, that's prescription drug coverage. So back in 2006, I was new to the business and learning right alongside people who had been selling traditional Medicare supplement plans for years. So this is my 19th year being licensed, and Medicare has always been my focus. So Medicare supplements, Medicare Advantage plans, Part D plans. The whole Medicare space has always been my baby, and it's really a rewarding spot to be in. Here at Ash Brokerage, we partner with financial advisors. So we offer insurance products for financial advisors and offer them to clients. Really, what my job is, we come in and we're that education component to help people navigate what all of their options are at 65. When you're turning 65, you've got a lot of decisions to make. When should I start drawing Social Security? When should I take Medicare? Should I delay Medicare if I'm still working? So really what me and my team focus on is helping clients navigate that decision of should I even go on Medicare? And then if so, what type of private coverage should I put along with it?
Yeah, we've worked with Ash Brokerage for many years, but it was a few years ago where I guess y'all started the Medicare practice, and it was perfect timing because we were starting to get a lot of questions about, hey, do you know anybody who can help me enroll in Medicare? And my answer before that was, no, I don't know anyone that specializes in that. And so it was a godsend that y'all started doing that. And it's been such a helpful benefit and resource. We've got nothing but positive feedback from our clients that we've connected you guys with. So I thought maybe to start off, someone's going to be listening to this podcast maybe this year or a year from now, and they're turning 65 this year. So what do they need to be thinking about as it relates to Medicare that year that they're turning 65?
Yeah, absolutely. I think that the perfect time to start planning is about 3 or 4 months away from that 65th birthday. So 65 is when you're first eligible for Medicare, or that's when most people are. Technically, if you're underage and on disability, you can get Medicare as well, but most people get it when they're turning 65. So like I said, about 3 or 4 months ahead of time is when we like to say, okay, what's our game plan with Medicare? Should we pick up Medicare and extra private coverage like a supplement or an Advantage plan? Or if you're still working, or if you're covered under an employer plan or a retiree plan, does it make more sense to stay on that and delay Medicare until later? So it's really not a one-size-fits-all when it comes to Medicare. It's going to depend on, if you're still working, what that employer coverage looks like. So typically, if we know someone's premium, deductible, max out-of-pocket, we can then compare that to what it would be on Medicare to see which is going to be more cost-effective and which is going to be better coverage for them. So there's a lot of moving pieces. Where someone is located is a factor. If they have employer coverage available to them, or if they have a spouse that's maybe not 65 yet who needs to be covered until they're eligible for Medicare.
Mm-hmm. Yeah, maybe talk about that, the timing piece. Assuming somebody is 65, they're no longer working, they're retired. What is that deadline to get enrolled?
Yeah, so your initial enrollment period is 3 months before, the month of, and 3 months after your 65th birthday. So your Medicare can start the first of the month in which you turn 65, Or if your date of birth falls on the first of the month, then they give you 1 month prior. So really your IEP or your initial election period is 7 months long. Like I said, I like to start planning about 3 or 4 months ahead of time to determine what's going to be that best fit.
That makes sense. We hear a lot of terminology, the alphabet soup of Medicare. Maybe touch on kind of what are those different letters, the alphabets? What do they all mean? What is somebody getting when they enroll in Medicare?
So original Medicare, if you hear someone refer to having original Medicare, that means Part A and Part B. So Part A of Medicare is inpatient hospitalization. That's if you go into the hospital. If you're admitted and staying overnight in the hospital, that's Part A. For most people, they don't pay a premium for Part A. So if you worked at least 10 years or 40 quarters, then you're going to get Part A of Medicare for no premium. Part B of Medicare is outpatient services. So family doctor, specialist, blood work, CT scans. Think of that as medical care where you're going home the same day. That's Part B of Medicare, and that does have a premium to it. So most people, the year right now, it's 2025. The standard Part B premium this year is $185 a month. So if you're drawing Social Security, you automatically get enrolled into Medicare at 65. If you're not drawing Social Security, then you would need to visit the Social Security website to enroll into Original Medicare. So getting Original Medicare Part A and Part B, that's the first step. And then you can choose extra private coverage to go along with your Medicare. So the thing to remember is that Original Medicare doesn't cover everything. If you have just Original Medicare, you don't have drug coverage. That doesn't cover long-term care, dental, vision, hearing. There's really big deductibles and coinsurance if you just have A and B. And so that's why people also choose private coverage like a supplement plan or an advantage plan to go along with Medicare.
And that's what I was going to ask is why do people not just stick with A and B is because there's gaps there in the coverage. You mentioned the supplemental and the advantage. Those are the two, at least from my experience, seems to be the big decision point for folks. What would you say are the major differences between those two types of plans, the supplemental and the advantage?
Yeah, definitely. So with a traditional Medicare supplement plan, sometimes you'll hear those referred to as Medigap plans. The way those work is you pay more in premium for it. So it's usually about $100 or $200 a month, depending on where you're located and your current age. So you pay more monthly for that, but then you have very little out of pocket when you use it. And you also, most importantly, have no network. So if someone does not want to have a network to adhere to, you want to go with a traditional Medicare supplement plan. If I have a Medicare supplement or a Medigap plan, that means that I can go see any doctor or hospital that accepts Medicare. So there's no HMO, there's no PPO, there's no referrals required. So if I'm traveling a lot or if I just don't want to have to deal with a network, I'm going to go with that traditional Medicare supplement. The other type of coverage, the Medicare Advantage plans, those are the ones that are ran by private insurance companies. And sometimes you'll hear those referred to as Part C of Medicare. The way that those work is they're much, much lower in premium. And in some areas, they're actually zero premium. But then you have co-pays when you use it. And you also have a network to adhere to. So usually if I'm talking to someone who's brand new on Medicare, I start with that. It's, would you rather pay more to have very little out of pocket and no network? Or would you rather pay very low or even zero and then have co-pays and a network to adhere to?
Yeah, that makes sense. And just from my experience to let listeners know what that process looks like for our clients, we're proactively reaching out to them that 3 to 4 months before they're turning 65. And we're very simply setting up a 3-way video call with Carly or one of her other team members. And they are walking the client through all their different options, getting an insight into, y'all got that great questionnaire to say, hey, is there any medications you're on? What pharmacy do you go to? Your primary care physician, to get some background there. And once they go through that option, they tell them to make sure you enroll in Part A and B, get your Medicare card in the mail. At that point, if they decide that, hey, I like one of these supplemental plans or I like this Advantage plan, your team from there maybe explain that next step. I step off at that point. Once the education piece is done, y'all help them enroll if they decide to move forward.
Yeah, definitely. So we will help with the entire process. So we help with the presentation, the quoting, explaining the different plans. And then we help with all servicing work as well. So if I've got someone who's enrolled into a plan, if they've got any questions throughout the year, they can always contact our team to get any questions answered. Or I always think it's a good idea to requote these plans every fall during the annual enrollment period to see if you should stay on your current plan or consider switching to a different company. And so, we will handle everything as far as the enrollment, checking the status, making sure you get your ID cards. And then that service component is also really important in case you have any ongoing questions or if your needs change. Maybe you get prescribed new medications or you want to go to a different doctor. We can help to make sure that they're covered and that new doctor is in network if you went with a network plan.
I'm glad you brought that up. I think that's so important for people to understand is, yes, the decision at 65 is very important. You want to make sure you've got all the information, you're enrolling in the right plan that suits your needs, but the ongoing resource and support that you can provide as your health situation may change. Or I believe you've even helped a couple of our clients that when we got connected, they had been on Medicare for a handful of years, but you were able to quote them a new plan at a more affordable rate. That's a fantastic additional service that not many people think about. Carly, last question. What are maybe 2 key points or factors to consider during the enrollment period that most people may overlook or they don't think about?
Yes, definitely. So I would say that the first one would be, let's make sure you don't have any late enrollment penalties. Sometimes people don't realize that if they don't make a decision, that they're going to have late enrollment penalties down the road. So if you're deciding to either go on Medicare at 65 or delay it until later, we need to make sure that employer coverage is creditable coverage. That way you don't have a penalty down the road. Another factor is trying to do this on your own. So I would say that another key component is let's make sure that you're not trying to do all of this navigation and this education on your own. I've seen people do their own research and try to do as best as they can to handle everything on their own. I would say partner with an independent agent or an independent brokerage to really help walk you through that process, because you can get mixed up and turned around if you're trying to navigate everything 100% on your own. We are independent, which means that we offer a lot of different insurance companies, and we can figure out based on your specific needs what's going to be a good fit for you.
Yeah, I think that's so important because I've just heard from experienced clients when they're turning 65, they're getting bombarded with information in the mail and call this and this plan. What's great with what Carly said is Ash being independent. I've been on the calls where the client will put in, Carly will pre-fill the information that the client provided, and there'll just be a list of all the plans available to them in their area, and she'll walk through the pros and cons rated to the price, how responsive that particular company maybe is to requests, or the likelihood that they may increase their costs over time historically, and just gives them an unbiased opinion on what plan may best suit their needs. Carly, any final thoughts or comments?
Yeah, absolutely. If anyone has any questions about what those steps look like or which companies are competitive in their area, definitely reach out to Alec and he can put together a meeting with all of us. We have clients fill out a real quick compliance form that gives us the permission to talk about all the different benefits. And then we just show you through a visual appointment who's competitive in your area and who's going to cover your prescriptions the best. So don't hesitate to reach out if you have any questions.
Carly, thank you so much for joining us today on the Ascent podcast. We appreciate your time and look forward to talking to you soon.
Okay, thank you so much.
My name is Alec Walker. You've been listening to The Ascent with Crestmont Private Wealth. You can contact us via info@crestmontpw.com or visit us on our website at crestmontpw.com. Have a great weekend.